Hi, this is Justin in partnership with Rolling Out Health IQ, and I'm here with Dr. Donna Patterson talking about your heart. Dr. Donna Patterson, it's so great to have you here. How are you doing today?
I'm doing well, Justin. Thank you for having me.
Of course. So question for you, heart disease. Why is it that African Americans have a higher prevalence of heart disease? Is it unique factors? Is it genetics? Like what is it?
I personally would say it is more so, it's not genetics because of the fact that it is preventable. Heart disease is preventable, and if it was genetics, we would not be able to prevent it. Heart disease, I think it's African American traditionally does not have access to care as maybe the other um, cultures, African American and Hispanics. And so if you were to compare, you'll find that we have a greater risk of developing obesity. And obesity leads to heart disease. Obesity is the underlying factor for high blood pressure, which is considered heart disease, high cholesterol, which is plaque buildup in your arteries, which can lead to heart attack and stroke. Those are all heart disease. And of course, you have congestive heart failure. So the heart, when it is the high blood pressure, when it's under stress, the heart will fail. It will not function at its full capacity. And that's when you have congestive heart failure. So definitely it's lifestyle, poor access to care, and maybe just the African American. One thing I want to point out too is that African Americans don't like going to the doctors, especially the male. And this may have stemmed from back in the days, we don't trust the health system because of maybe the Tuskegee experiment. And we feel that it was African Americans that were in those experiments. And so there's a lack of trust where the healthcare system is concerned. There's also researches that have been done that showed that when African American are in a hospital setting, they do not get the same quality of care and referrals as does the other cultures do. And so if you ask for pain medication, you're going to get um, pushback because now you're seeking. If you need a cardiologist, you won't be easily referred to see one, or you won't be easily referred to see a neurologist as the others would be. And it's because of bias in the hospitals, in the healthcare setting.
That bias, that's kind of scary. And so what
Yes.
and so what should patients or what should African Americans be then aware of in order to help mitigate that bias and get the care that they need for
Well,
their
first of all, what we should be aware of is our own health and learn how to advocate for ourselves. But before you become a number in the health system, you want to start by prevention. You want to learn, what can I do to take care of myself so I don't need to go to the hospital for high blood pressure, or I don't need to go see a doctor for a heart attack or a stroke. By taking those preventative measures, watching what you eat, making better food choices, healthier lifestyle, exercising and moving more, you are mitigating those issues that could potentially arise when you get to the hospital setting.
so then in your opinion and in your professional opinion, based on your experience, what has been the single most effective way to mitigate heart disease and have a healthier heart?
I would definitely say healthy lifestyle. Healthy lifestyle reduces the risk factors for cardiovascular disease, for high blood pressure, which is known as the silent killer. And so many people are walking around with high blood pressure and they don't even know it. So healthy lifestyle, watching what you eat, watching your sodium intake, reading food labels and making sure that you're using fresh vegetables versus canned vegetables, making sure that you're reducing the amount of fat in your diet, dietary fat. You want to make sure that you're doing good fat and using healthy oils instead of just using like the vegetable oils that are unhealthy. So, healthy lifestyle, how much you eat. It's not about what you eat so much, but how much of it that you consume. And so, being able to portion size your meal and eat healthier amount and not stuff yourself. Uh, that is basically healthy living. And if you're doing that and exercising, moving your body more, you will mitigate the risk factors for heart disease for sure.
Now, when we talk about movement, we talk about access. What are we talked about reasons why we don't go. Black males don't go to the doctor. Are there any other myths that you like to debunk about heart health that you just see on the regular from African Americans, or people of color that you're like, I just wish people would stop saying this, or something that keeps coming up in Google and you're like, I just need to put this to rest with heart health?
Um, Let me think for a second. Well, not necessarily a myth, but most people feel like they don't need to see or go see a doctor if they're not sick. They're like, well, why do I need to go in for a checkup? I feel fine. And I think I see that so often. And most times, too, it is usually the women or the wives that are dragging the husbands to the hospital. They'll be having chest pain, and they're like, oh, I'll just go lay down for a little bit. I want people to know that heart attack is real and high blood pressure is real. High blood pressure can cause stroke. High blood pressure can cause kidney failure. So if and when you get to the point where you have these symptoms, make sure that you are going to see a healthcare professional. Don't just say, oh, it's indigestion, or, oh, I'll just go lay down. I think I'll feel better later. Make sure when it comes to your chest area, where your heart and your lung resides, do not put that off at all. Always seek help. Even if it's indigestion, it's better to be told that it's nothing than to find out that you had a heart attack and now your heart is so badly damaged because you turned up too late that we can do nothing about it.
That's a really key piece of advice. I feel like um, there there are medicines that generationally we kind of strayed away from, or there are medicines that we just refuse to take, right? But yet we would, as a people, be comfortable with just going to fried food, processed food. Are there any advancements in the medication that have been directed towards African American or even Americans, or even have there been, significant strides in getting better access to care for African Americans or diagnostics? Like, what are your thoughts on that? Because I mean, it's ease of use. Like, it's one thing if we're afraid of certain things, but there's another thing to then say, hey, on the opposite end, the access has gotten better, the medication has gotten better. What are your professional thoughts on that?
Well, definitely the medication has gotten better, and definitely there's more access. There has been advances in how we care for patients, including cardiovascular patients. The medications, of course, all comes with risk factors. And so, yes, most people, most men especially, may not want to take certain types of medication because if you're taking some specific types of blood pressure medication, it can cause erectile dysfunction. And no man want to mess with their stuff. And so they will refuse to take. I've actually had patients who said, I don't want to be on this medication. I don't want to be on blood pressure medicine when their pressure is 197 over 112, which is extremely high. And so now it's all about education. If you're not going to make the change by lifestyle, you're going to cut out the greasy food and the salty food and the pizza and the mac and cheese and all the stuff that can potentially lead to high blood pressure, then we have no choice but to put you on the medication to keep you healthy. And so we have to understand that it's a choice. Either you're going to be on medication or you're going to live healthy lifestyle. But one way or the other, if you are diagnosed with high blood pressure, this can kill you. And so it is necessary that you take the steps um, to prevent having to be on the medication in the first place that can cause you to not function because you may feel like, oh, I'm not going to be considered a man or as much of a man if I take it and my stuff doesn't work. So, what are your options? Healthy living, healthy lifestyle. There's no two way around it.
Dr. Donna Patterson, is there any place that people can actually find you? Where are you? Where is your health spa located? How can people get in touch with you?
We are located in McDonough, Georgia. We're at 2023 Jonesboro Road in McDonough, Georgia. We can be found on Instagram at Rejuvenere Health. That is Rejuvenere Health. That's also our website, www.rejuvenerehealth.com. Or we can be called. We're also on Facebook and TikTok.
Thank you. Dr. Patterson, this is perfect. Really appreciate your time. And the community thanks you for your hard work and stewardship towards healing us. So thank you so much.
Thank you so much, Justin. Thanks for having me again.
Thank you.